One of our favorites, Dr. Zach Levine, is back from the MUHC. Dr. Zach is talking about Zika. We heard a lot about it in the news last year, a lot of panic, a lot of misinformation, a lot of questions, a lot of you getting ready to go on spring break. Thank you so much for joining us this morning.
Thank you.
Let's talk about, first of all, first and foremost, what is Zika?
So Zika is a virus, and like many, we're constantly bombarded by contact with viruses. And this is a virus that is transmitted by a mosquito bite, a particular mosquito that is found now in more and more places, including last time I was here, we talked about the Caribbean and Mexico and the southern U.S., and now all those places have had confirmed cases of mosquitoes carrying Zika virus.
Right. And so why Zika is dangerous, from what we can put together, and then you're going to explain this to us, is particularly for women who are pregnant or thinking about becoming pregnant. Explain this to us.
Exactly. There are two significant complications because the Zika infection itself is not, first of all, it's important to note that 70 or 80% of people who catch it don't have any symptoms.
It's asymptomatic. You
So
can
you
have
may not
Zika
know.
and you wouldn't know it, right?
Exactly. So that's important to know. So if you're exposed and you're trying to get pregnant, then it's important because even if you don't have symptoms, it's important to get it checked out. The main thing that we worry about is something called microcephaly, which is basically a small brain and a small head in a baby, in a newborn baby, which is associated with intellectual handicap.
Right.
So
We saw a lot of that last year. There was a lot of images coming out of Brazil because that seemed to have been sort of the hot spot.
And you can see it.
Yeah.
You see the pictures, and you can see it's not totally
Yeah, we
normal.
were looking at some images there of the children who unfortunately have microcephaly.
Yeah.
And there's also another
Yes.
issue associated with. Yeah. What is that exactly?
So it's a neurological disorder that's rare. It's like 1 in 100,000 normally, and Zika, being exposed to Zika, increases the risk to 1 in 5,000. So it's still rare, and it's what we call an ascending neuropathy, which means weakness that starts in the legs and it can go up into your upper body, and even in severe cases it can cause people to have difficulty breathing and speaking. So it can be very, very severe.
And you would notice this
dangerous.
in the infant when it was
Oh, sorry,
born?
that's not a baby one.
Okay.
That's for the person who actually catches. That's for
okay.
Yeah,
so
exactly.
microcephaly is for the fetus, for
Exactly,
the baby, and then the other one, which is what again? Say that again?
Guillain-Barré.
So that happens in adults.
In adults, yeah, exactly.
So at the end of the day, the other thing that people are not realizing is that it's sexually transmitted.
Very important,
and
yes.
talk to us about how long it actually lives longer in men, the virus, than in women. So explain this to us.
So it lives in body fluids. It lives in blood. It lives in urine. It lives in semen. And it lives longest in semen. So the recommendation is after you've traveled somewhere with Zika to not try and get pregnant. The man should not be having unprotected sex for a good 6 months afterwards.
6 months.
Yeah. A woman
is
more like 2 months.
So 2 months.
Yeah.
And then, but if you're traveling with your partner and you're trying to have a baby with your partner,
you have to wait 6 months.
You have to wait 6 months. So, I mean, when we talked about where it's spread now, so like places like Florida, the southern belts of the United States.
Confirmed cases in Florida, confirmed cases in Texas, and the Caribbean for sure, and Mexico as well, and then further away as well. You talked about Brazil and South America, absolutely.
So if you are traveling to one of these affected areas, what should you do?
So you protect yourself from mosquito bites as much as you can. The mosquito that transmits this primarily bites during the day, so protect yourself during the day. Now it's hard when it's hot out, but the things that we recommend are definitely insect repellent. Definitely, if you can, cover clothing. Clothing, especially you can get clothing that's actually treated with something called permethrin, which isn't always, you don't want to cover yourself up necessarily because you'll be hot. But if you need to protect yourself and you have to be down there, then do it. Empty out, you don't want standing water. That's where mosquitoes like to breed.
Yeah.
So empty out, if you have bowls of water, empty them out.
Toss them out?
Toss them out.
And if you are traveling with a young child or an infant, can it be dangerous for the child?
Not really. I mean, there is some risk for the Guillain-Barré. It can't cause microcephaly in a child or an adult who's already born. This is really a disease, a worry. That microcephaly is really a worry.
In the developmental,
in utero.
in utero. Okay.
Yeah.
So can you obviously protect the infant as well if you're there?
Exactly. The exact same things
Repellent,
apply.
loose clothing.
And also, I didn't mention screens. Use screens, use air conditioning, anything that will protect you from getting mosquito bites.
And if you are concerned that if you've been infected, you can go and get tested at the hospital?
Exactly. So testing is done. You can get it done at the MUHC now, at any of the major hospitals, and it's a blood test. Even though it's carried in other, like I mentioned, it's in semen, it's in urine.
It's a blood test,
blood test, yeah.
For more information on all this, for what Dr. Zach, of course, btmontreal.ca. /blogs. Dr. Zach, thank you so much for joining us.
Thank you.
I know it's hard, but try to cover yourself in loose clothing in the sun. Thank you again. Stay tuned. You're watching Breakfast Television.